talk about how we can shed the overhead albatross. Gordon Moore in 2002 did this amazing thing where he opened up a solo practice. It was just him in an examining room with a computer. And his idea was if we get right back down to the most important thing, and that's the doctor-patient relationship, and use technology to reduce the overhead, then maybe wonderful things can happen. And so he did 2 articles in Family Practice Management, and they became actually some of the most famous articles in family practice management history. In 2000, in fact, he had such a huge response that in 2003 he opened up a Practice Improvement 1 listserv where physicians from around the country could share information on how they feel that they can make things better. And that was started really with only about 5 or 6 physicians. Now it has over 900 members. The first IMP cohort, which was a collaboration between physicians from the Practice Improvement 1 listserv and Dr. John Wasson at Dartmouth University, was launched in 2006, and we used How's Your Health to track our data. And then we published numerous articles based on that data, showing that indeed we were doing some kind of neat stuff. As the group continued to grow, there was a need to consider starting a nonprofit organization, and indeed that was started in 2009 and has been continually increasing its membership since. So what is an ideal medical practice? It's a physician or a group of physicians focused on providing accessible, efficient, and reliably high-quality care in an environment which is healing for both the patient and the physician. In 2007, we had our first IMP camp, and that was a group of us doctors, all from the Practice Improvement 1 listserv, that decided we wanted to get together in person and meet each other finally after emailing back and forth for years. And we had our first IMP camp in Woodland Park, Colorado. We've had an annual IMP camp ever since, and this year it's going to be in Washington, D.C. In October. So look out for that. What are some of the demographics of an IMP? Well, this is back in 2007. Our practices were still pretty young back then. The age of the practice would range from maybe 2 to 4 years old. So certain of these numbers would have changed by now. But at the time, we were seeing 11 patients a day and had about 800 patients per practice. The average reimbursement for visits is $87. But the key is the overhead was only $7,562 a month. So the overhead was kept pretty low, which was really the key to bringing home the net annual revenue. Again, I would argue that the annual revenue is up much higher than that now because the practices have become more established. What are the marks of an ideal medical practice? And by the way, it does not have to be a solo practice, although most IMPs are. It can have any number of physicians. The key is, though, that they have to really meet these attributes, and that's that the care is driven by the physician needs, goals, and values. Sorry, the patient's needs, goals, and values, not the physician's. That's an absolutely important thing. Access is 24/7. The care team utilizes technology to the fullest. That's electronic health records, emailing, internet scheduling, things like that. Patients can see their own physician whenever they choose. It's absolutely essential to have a physician who knows you and knows your medical problems. And the majority of the office visit, of course, is spent with the physician, not in the waiting room. Overhead is low. Patients are seen the same day. The physicians are able to see fewer patients per day because the overhead is so low. And then, of course, we have to measure ourselves regularly so that we can improve and become proactive with the care of our patients through the review of our systems. And this is important. Physicians should feel satisfied and feel in control because they've been given their autonomy back. So how do IMPs do versus non-IMPs? Again, this goes back to the IMP cohort study, which was initially published in 2006, but this is from Family Practice Management 2007. And what you see is that about twice as many of IMP patients feel they get exactly the care they want and need, exactly when and how they want and need it. We're still only at about 60%. That's not wonderful, but that's, it's twice national average. but it's not as wonderful as we'd like it to be. We still have a lot of room for improvement, but that's pretty good. As you can expect, efficiency, access, and good information are all also much better in an IMP practice than a non-IMP practice, not only because we can spend more time with the patients, but also it's reflected in the patient saying that they get perfect care, as shown in previous slides. Interestingly also, patients feel like IMP doctors are more aware of their emotions and their emotional conditions, and that goes along with the patient feeling that they have a doctor who knows them and knows their situation. Other interesting thing, this was an unpublished data from 2007, but at that time 90%, or nearing 90%, were satisfied or very satisfied practicing medicine of the IMPs. Again, remember the comparison number is 40% in the general population. So probably twice the number of IMPs are satisfied practicing medicine versus traditional people in a traditional system. But there's always a wonderful argument that, hey, okay, there's a primary care shortage going on. We're going to have this huge problem. So going IMP is going to exacerbate the problem. Let's talk a little bit about that. First of all, I think we should look at this issue through the lens of the patient. And that's because the patient is the one with the disease. The patient is the one who has to get in. The patient is the one who controls really whether they go to the emergency room, urgent care, or come to your office. So through the lens of the patient, how many other patients do you want your doctor to see a day? I would say patients would probably not want their doctors to see 60 patients a day. Now maybe I'm wrong on that, but it goes back to the processes of the office. I think if a patient knows that you're seeing 60 patients a day, they will pretty much realize that they're not going to be able to get their phone call answered, that they're not going to be able to be seen the same day, that it's just going to be a complex mess. Second part is through the lens of the doctor. How many patients would you see a day if you were independently wealthy? Again, this goes back to physician satisfaction, and the data that we have that's been pretty consistent over the last decade is 60% of physicians would say 0. If they were independently wealthy, they would leave medicine, period, no questions. And so that's a real issue that needs to be dealt with. And then finally, through the lens of society, how many primary care providers do we need to take care of the population? Well, that's an interesting question because we always hear that there's this huge crisis going on in primary care. So let's look at this. We have right now 220,000 primary care doctors. If you add nurse practitioners and primary care physician assistants, we have 336 primary care providers. So let's do something simple and divide that into the population of the United States, which is about 310 million. What you find is, assuming everyone is covered, which is of course not the case in this country, the number of patients per primary care physician is about 1,400, and the number of patients per primary care provider is 922. That's interesting. Now let's look at something else. Let's look at Ostapai's number. Remember, Ostapai was the one who said we needed to work 22.2 hours a day in order to take care of 2,500 patients. So what if you only wanted to work 8 hours a day? How many patients would you need in your panel in order to work 8 hours a day and take care of all their needs? Well, when you do the math, it comes out to 901 patients. So although this probably is in fact my strong opinion based on that simple data, is that there are enough primary care providers to take care of the population. That actually the solution to the future of medicine, and primary care in particular, rests in changing the toxic environment in which primary care is practiced, not by shoving more people into already overworked clinics. You can turn the treadmill up faster if you want, but the only thing you're going to do by doing that is make physicians more miserable, and that's not going to solve any problems at all. So the best way to measure effective primary care is to ask the patient through a well-studied tool like How's Your Health, and then implement changes focused on patient-centered collaborative care. Ideal medical practices have been doing this. We understand how to do it, and we've proven that very small practices can indeed offer high-quality care. So what now? Well, here are some different things that you can do now. Certainly, you can open up your own IMP, but do some pilot studies. Do some other small things first to see how to make life better for you and for your patients. Here's some simple contact information. I'll leave that up here as I finish the lecture. Thank you so much for listening. Bye.